Dr. Taylor Andrews here, going to talk to you guys about dry needling. So let's say we've decided that we want to do it. I've pulled you into the room. If it's an area that is a sensitive area that I need to drape, maybe some of the glute muscles or some of the low back muscles, we'll go into a private treatment room. We'll do some draping. You never have to completely disrobe or anything like that. I can work with just about any type of clothing that you've got on, get to where I want to. I'm always going to use an alcohol wipe and sanitize the area, so it's a nice and sanitary method that we do. So I kind of poke around and leave a little dot with a marker of where I want to go. What I'll do then is I'll insert the needles. This is an example of some of them. Like I was saying, they're very thin and wispy. You might not even be able to quite pick them up here on the video. We would insert the needles, and it just kind of depends on how long I'm going to leave them in for. Sometimes I might leave them in for like 5-10 minutes. Sometimes it might be in there for 15-20 minutes. Just depends on how the patient is tolerating things. Another thing that I might do is set up the E-Stim unit. So it kind of works like jumper cables almost. I can set up these alligator clips here, connect them to the ends of the needles to create an electrical current. What that does is it sends extra blood flow to those muscle groups that we're working on, or those tendons or ligaments. If it's set in a muscle group, it can also get that muscle to pulse a little bit, have that muscle start to contract. It just allows for a quicker release of those muscles. So I really like, when I can, I really like to use the TENS unit here, so long as the patient can tolerate it. It's going to be a comfortable amount too. With all of what we're talking about here, the needles, the TENS unit, we're always going to make sure that we're setting things up to where they're tolerable.